I was operating on a patient with a brain tumor. And I realized that when I was under the microscope, that my left side was not quite working 100%. There's something going on here.
I had already called the emergency department to say our colleague, Dr. Gentili, is coming downstairs. He's going to need a scan, and I'm going to go finish up the OR. I called one of my other colleagues who was already here to say, please go down to the OR and help to manage the situation in the OR.
And sure enough, the MRI scan showed up these 2 lumps in the right side of my brain. Can you imagine? My fellows were there, the residents were there. I said, well, guys, what are we looking at? I said, and don't fake it. Look like these are tumors.
You cannot Google skull-base surgery and not find Dr. Gentili.
Dr. Gentili really is a master surgeon.
He's really the doctor that the other neurosurgeons go to when they're in trouble, when they have a tough case.
He's a neurosurgeon of international rank.
Dr. Gentili is, without question, the leader in endonasal skull-base surgery.
Yeah, you know, it's interesting because I've always thought I'm going to get a glioblastoma. I never thought Fred was going to get a glioblastoma. It was never an idea in my head. And so when I heard the description of the MRI, I thought this can't be.
It is an irony, of course. I think that being faced with a diagnosis that you know so well, that you have treated so many times, on one level can be comforting because you know what you're talking about, you know exactly what, so there are no uncertainties, but at the same time can be dreading to face.
He has a sense of cynicism. He'll tell you that himself, I think. And so he was trying to make light of it. But I think we both knew that this is really going to be a very sharp turning point for him.
It really didn't hit me until I went to the hospital that evening to pick him up. He had to undergo a battery of tests, and there was a phalanx of surgeons around him, surgeons I know well. And when I saw the look on their faces, I knew the depth of the situation.
For me to believe that I would ever be diagnosed with a GBM is like, it's like a storybook fantasy that can make a movie out of it.
So this is the challenge with this tumor, in that it never goes away. It's from the moment you get diagnosed to the moment that it takes your life, you need to continue battling it. And unfortunately, the outcome generally is 18 to 20 months. And that's the challenge, because every day is the best day you're going to have. We spoke a lot on that weekend and made sure that the plan was suitable to him. And then he and I discussed, whether he wants to go away for surgery, have somebody else do the operation, get another opinion. And that's when he was actually quite brave, and I would have to say sweet, because he said he wouldn't want anybody else to do it but me. So, and this is an operation that I could do regularly with no strain, but of course, operating on my mentor, my colleague, it was quite stressful. So, but I was really proud and honored that he felt comfortable.
I had the honor to help Dr. Zadeh during the surgery, so I was present in the OR when Fred came in, and he commented a lot about the irony of the situation, but then he said, well, I trained all of you, so of course I'm the patient, but I'm also the surgeon today. So it's like the surgeon's doing his own surgery because you guys will do the same as I trained you to do.
It's an oxymoron, eh? A neurosurgeon diagnosed with a brain tumor and then is operated on by a colleague.
It is the irony of life.
Devastating news, devastating for everybody involved, I think, but you know, more than people who've met him, it's really devastating for the society of neuro-oncologists, for neurosurgeons, for future trainees at the University of Toronto. Overall, really, you know, heartbreaking to see, but also very inspiring at the same time when you speak to Dr. Gentili about it and you hear his perspective. I mean, it's just remarkable how he kind of describes his story.
Well, the perspective is somehow you think that you're so special, but you're not. Doesn't matter that I'm a surgeon, that I'm a neurosurgeon, I'm a patient.
I think it'll always stick with me, kind of his description of the first time that he was in line at Princess Margaret Hospital, waiting to be seen by oncologists.
He's learned about what it's like to walk through those doors. When you have to wait in a waiting room for the blood to be taken, when you actually have to go into the room where they perform radiation, or you have to go to the pharmacy and fill a prescription.
Simple things that we take for granted because we go there, we go underneath, we have a pass where we park, but no, not everybody has that. You have to find a spot. Sometimes you can't find a spot.
We're very good at learning how to diagnose, to operate, to manage, to do research. But we really need to better understand how is it that it impacts the patient. And although we have empathy, until we actually know from people's perspective what every step of the way feels like, how it changes your life, and what gaps are there in their care, I don't think we've done a complete job.
Everything we do in medicine is for the patient. And we say it's for the patient, but it's hard to know what's for the patient until you truly understand what the patient is going through.
I joke about the fact that every neurosurgeon should have a brain tumor operation. Now, you know, it's not feasible, I wouldn't want it on neurosurgeons, but it's that issue that we don't realize what our patients go through.
Going through this process, understanding what patients are going through, and finding out what they need, advocating for them based off what their needs are, is the most important thing that we can do in medicine. That might be medical related, it may not be medically related.
I think ultimately, if we're able to gather as many perspectives as possible, to be guided by those who live through the disease, to improve the care that we deliver, then we have it right.
This is where doctors can be more advocates for patients and encourage patients to be advocates for themselves, because we don't often do that.
By every definition, Dr. Gentili is a master neurosurgeon. And when he talks about the experience of having a mask put on and how difficult that was, or how different that was for him, and he didn't even know that despite him treating thousands of patients who would have always had that.
I think when patient advocacy is done well, we have a better and a more granular understanding of gaps in care, whether it's from a patient experience, from quality of life, from response to treatment, to end-of-life care. Advocacy done well means that the gaps are filled so that we don't have the peaks and valleys in what we do for our patients.
We take it for granted. I mean, of course, you're an advocate for your patients. Doctors should be. But in terms of, you know, following through to true patient advocacy, I think it's hard work, takes commitment, takes, and everybody should be doing it.
Our brain is the most complex organ that we have, and it's the most invaluable, precious organ that we have because it makes each of us who we are.
We see these diseases that are absolutely devastating, unfortunately, every single day.
The final solution to my problem is going to be not surgery. It's going to be research funding, molecular biology, looking at under the microscope to check the cells.
We're not going to solve this problem by only having patients in the hospital and treating patients in the hospital. The way we're going to solve this problem is by studying it, by researching it.
In order to move our research forward, we need to recruit and retain the best talent. We need to continue and increase our funding.
With time, with research, with dedication, with the right people at the helm, people like Dr. Gentili, for example, these problems are solvable. And it's a matter of getting everyone together with the resources to be able to do this.
Funding is critically important. We have an amazing, intelligent, groundbreaking team at UHN.
We have very high quality people. We have very good trainees that we attract from all over the world. We're very well equipped to do what we do.
It's essential that we continue understanding what drives diseases, what impacts brain function, how we can reverse it, how we can intervene with minimal damage to the brain, and most importantly, prevent it from happening in the first place.
There's no option to not move forward. We have to, and it requires everyone to come together to make this happen.
I think there's a lot that we need to learn about the brain and how it works, what makes us who we are, and how we can prevent disease, and we just have to keep going till we find the answers, and we can't give up.
Fred lives, breathes, eats, and lives neurosurgery. It's his life, it's his passion, it's his fire.
Fred's story is a man who's dedicated almost every hour of his life to curing brain tumors, to removing them as best as he can. And now he's on the other side with the diagnosis himself, and very quickly coming to terms with the diagnosis, knowing the impact of it on his life and his loved ones.
He's transitioned from one day being a surgeon and inspiring and being a mentor to now being a patient. I'm very proud of him. He has never complained. He has taken every turn with grace and elegance and strength.
And most importantly, being so very generous with his time and very free with his vulnerabilities. From the moment he showed up in the OR, he was free with taking pictures of him, speaking about his experience, documenting.
He still tries to make an impact every day. People still call, people ask him questions, advice.
Fred being open to sharing his experience and his vulnerabilities with his diagnosis is a reflection of his passion and his drive to make an impact on the outcome for brain tumor patients.